So welcome back today on episode 44 or Taking Charge of My Cancer podcast. And I have a very special guest today with me, Dr. Jasmine Zheng. Dr. Zheng completed her medical training at Georgetown University and went on to receive her residency training at University of Michigan, where she began developing a passion for cancer rehabilitation. It's a specialty in the field of rehabilitation medicine aimed to maximize and restore a person's physical, social, psychological, and vocational function through the cancer care continuum. After residency, she became an assistant professor of physical medicine and rehabilitation, PM&R, at the University of Pennsylvania, where she has grown the cancer rehabilitation practice and helped begin the Penn First Cancer Rehabilitation Fellowship. She currently serves as a director of Penn's Medicine Cancer Rehabilitation Program as a director of the Cancer Rehabilitation Fellowship and is a provider in Penn Center of Lymphatic Disorders. She received her certification as a lymphedema therapist and collaborates closely with the Good Shepherd Penn Partners Oncology-Lymphedema team and sees patients for cancer and cancer-related treatment issues and cancer and non-cancer related lymphedema. She has given talks regional, national, and internationally on topics such as cancer rehabilitation care and lymphedema. So it's an honor to have you here with me this evening, Dr. Zheng. Thank you so much for being here.
Thank you so much, Shirley. It's my pleasure to be here today.
And we met not long ago. So it was back in October at NLN. And I was so humble, when you just told me, I'm a CLT. And it's like, oh yeah, a lot of the CLTs that are around this, conference, because that was the National Lymphedema Network conference. And it's like, I'm as well a physician, but I'm a CLT as well. And I'm like, oh, that is amazing, because I don't know if I know of any of the physicians at all I have come across that decide to go in to do a CLT certification. So I would ask you more questions, but that was totally impressed me, how much your passion and how much you really care for these patients that you went beyond, because it's not easy doing the CLT certification, and certainly when you don't have some of that rehab background for the PTA standpoint. I mean, it's from your rehabilitation medicine especially, but I was really oh my God, this is amazing. So thank you for that.
Of course, of course.
So you want to tell us about your role and were you always planning on doing this?
I would say no, definitely not. I think I started medical school because I was interested in humanities and I was interested in people. And I was definitely not one of the medical students who went into medical school with a ton of background in medicine already, or family members who had done medicine, or those who knew, okay, I know I want to be an anesthesiologist, or I know I'm going to go into this and be an orthopedic surgeon. And I was kind of like, I'm not really sure. And I wasn't really sure if I was in the right place, to be honest. And medical school was tough. Coming close to the end of my time there, I was torn between internal medicine, neurology, and then there was an opportunity to do 2 weeks of elective time on a rotation called physical medicine and rehabilitation. I'd never heard of it. I had no idea what it was. And I read a little bit about it online, okay, this is about helping people restore their quality of life and function. I was like, well, that sounds good. And so, I did this 2-week rotation. It was my first time ever working with PM&R clinicians and understanding that they were part of a multidisciplinary team. They work so closely with other clinicians from therapy backgrounds, from social work, case management, and other medical subspecialties as well, like surgeons. And I said, hey, you know what? This might be where I fit. And I've always been drawn to maybe the fields or the things that I think tends to be a little bit neglected. And I felt like this was a field that was so important, but people didn't know enough about it. Mm-hmm. And a lot of times in medicine, we're so focused on treating the acute problem, which is important, right? If someone comes in the emergency room with appendix rupture, of course, we're going to have to treat that emergently and acutely. But then it's what happens after that. And we forget sometimes about how important still quality of life is, despite survival of a terrible disease or medical condition. I mean, take long COVID, for example, right? We might survive the COVID infection, but then what about the consequences of that and the people who suffer for weeks or months or years afterward with long COVID symptoms? And so that's what sort of drew me to PM&R. And I left medical school, going into residency, determined to make a name for PM&R and to spread the word about PM&R. And even when I was in residency, I wasn't sure what exactly I wanted to do. There's so many subspecialties within PM&R, for example, spinal cord injury, traumatic brain injury. There is sports medicine, pain medicine, interventional spine, palliative medicine. And for a time, I thought maybe I wanted to do orthotics and prosthetics. And I happened to have a physician at University of Michigan, Dr. Sean Smith. He's still there. He's now a leader in cancer rehabilitation. But I saw him begin this cancer rehab program from nothing at University of Michigan. It was very inspiring to watch. And he really cultured this idea of rehabilitation in oncology patients is really important. And so I had the fortune of being able to work with him. And that was my first exposure to that field.
Great.
And so when I started and when I graduated residency, I was looking for an academic position, meaning I wanted to be at a big hospital center that was connected with a university where there are researchers and researcher scientists, clinician scientists, and the opportunity for me to work with residents and medical students. And even when I graduated, I wasn't quite sure if I could commit, 100% to, orthotics and prosthetics or cancer rehab. And so I said, you know what, let me start kind of general rehab. I get to see everything. And I have these interests, and let me see if I can culture these interests and see what happens. And I'm so glad that's what I did, and after about a year or so, I kind of saw myself turning towards the cancer population and growing that field. And around that time, at University of Pennsylvania, we have a fabulous oncology-lymphedema therapy team. And Joy Cohn was the leader of the team leader of that group at the time. And I spoke with her, and she said, I think it might be really helpful for you to consider getting lymphedema therapy training.
Wow.
And that was how that started. So I remember looking into the Norton School, and I said, okay, let me fly down to, I flew down to Round Rock, Texas. I've never been down to Austin or Round Rock before. I went down to Round Rock, Texas, and did the 10-day course to get my certified lymphedema therapy training. And I am so glad I did that. I am so grateful for that experience. I was a little hesitant at first, and I was like, oh my gosh, like, is this like too not what I'm doing in clinic? Is this really relevant? And Durley, I have not gotten good lymphatic system training education ever, until I took that 10-day course. And it's amazing how important the lymphatic system is, yet our current medical school education doesn't really emphasize or make room for it. And I think part of the problem is, one, there's so much that we still don't know about the lymphatic system. It's poorly understood. And also, two, it does affect every body system, right? And so it's hard to figure out, where do we teach it and who takes ownership of it?
Yep. Yeah.
So So anyways, long story short, I took this course. I really found it to be enjoyable, and I felt like I could finally talk to my patients about what lymphedema therapy really was and communicate with my colleague therapists in a way that they could understand and that I could understand, and that we could come to a productive plan together.
That's
So,
that's amazing. And sometimes we come across amazing physicians who really want to know more about it, and they go beyond what the specialty is to try to really help these patients with lymphedema. But when it's somebody, like them or like you, that we are talking about the same language, sometimes I'm in the phone with, nephrologists or cardiologists who have absolutely no idea when we talk about if I'm going to do a full CDT, which is completely decongestive therapy on your patient, and you're not telling me they're okay on their heart, I can really send them into a cardiac arrest.
right.
Or with a nephrologist, I remember having this patient with a kidney transplant, and she was like, in restriction with fluids, and same thing. And I'm like, I need to get an okay from the nephrologist, because there's no way we can throw this much fluid to your kidney if I'm going to damage the transplant that is going to happen. And talking with these docs on the phone, they have like absolutely no idea. And it's just kind of, again, they start the education on like, well, let me tell you how many liters I'm going to send of fluid into these organs. And our kidney is okay for those organs to take it. And if it's medically stable, okay, then we go for it. If not, you need to make them stable before I can do this. So it is really amazing. You're right. Like the lack of education, which, again, I don't blame it, because you're right. It's such a, I mean, you guys in medical school learn so much from everything that is so hard to go specific. But I hope that with all the advance we're seeing now in lymphedema and all the amount of research is being done about the lymphatic system, hopefully, people like you that I want to hear more about this fellowship can start to really maybe implant back into med school some changes that will be ideal.
Yes,
Tell me about the
absolutely.
fellowship. This is exciting.
Oh yeah, so we have a Cancer Rehabilitation Fellowship. So that was started 4 years ago. Right now we have our fourth fellow. And in the United States, we only have a limited number of fellowships. So about a little over 10 years ago, like 10 to 15 years ago, there were, I think, only like 2 fellowships in the country. And since that time, we have over 10, and offers, now it's about 12 to 13 spots total. And so University of Pennsylvania, 4 years ago, decided that this was an important piece of educational opportunity that we could offer. And so my department was very supportive, as was Good Shepherd Penn Partners, in funding this fellowship position. And so the Cancer Rehab Fellowship, it's a 1-year program that we offer, and it gives the fellow opportunity. So it's someone who graduated PM&R residency, and a 1-year opportunity to gain additional experience in management of neuromusculoskeletal conditions in oncology patients, including conditions like cancer-related lymphedema. And so it's a combination of both outpatient and inpatient exposure, research, program development. And it's been really, really exciting to be able to offer this and to try to grow the field. And because of my passion in lymphedema and lymphatic diseases, I think one thing that makes our program a little bit more unique is emphasis in that. And one of my colleagues who also helps to teach, Dr. Betty Chernak, is a palliative care physician. So one of the other things about our program that's a bit unique is more of the emphasis on supportive care and symptom management.
Okay, great. That's excellent. I wish we have something down here at UF. Happening anytime soon, but so will you give us any valuable tips for cancer patients?
Yeah. So in working with cancer patients, you mean?
Yep.
Yeah. I think number one is listen. And just listen. I think that's so important. I think in any aspect of our lives, honestly, not just working with cancer patients, any patient or any area of work or social life or family life. I've just realized going through training and then being out of training and working with patients and colleagues that if your mind is so busy just thinking of the next thing you're going to say, you're not doing anyone any service. And when patients come in the room, they really want to know they've been heard and feel like they've been heard. And I think so many times when there are sort of poor interactions between clinicians and patients, it's because the patient never feels that they were fully heard. And I think it's hard in today's world because many physicians are under the constraints of, I only have 15 minutes per visit. You know, I have to see 30 patients a day. I have, you know, and lack of support or the pressures of, you know, the system. But even so, I think we can't use that as an excuse. And I think we still have to make an effort to ensure that we are able to reflect back what patients are truly telling us. And sometimes that's all they need, you know, in addition to any pharmacologic management suggestions or treatments. So I think that's one thing. Listen to your cancer patient. And then two, I think I think it's such a rewarding field to go into, oncology rehab. And I think it's not without its challenges, but I think that's actually a beautiful thing because challenges are what helps us all grow. Yep. And if every patient encounter was easy, we never learn to become better clinicians, right? And it's through those challenging cases and coming out of it, being closer with your patient and having found a solution that can really make everyone feel good. Yeah. And so don't shy away from managing, you know, patients in the oncology field because it's complicated or complex and tough, but rather maybe let that be the thing that draws you to it.
Yep. Yeah. And it is such a big need, right? I mean, how many, again, cancer rehab has been growing so much or has been there, but it's more and more people knows about it. We have programs like your program, our program, where this is just part of, you have a patient with a cancer diagnosis, the referral comes to us.
Yeah.
So to try to really start to looking at that whole picture of that patient. So it's not just the chemo part, it's not just the surgical part, it's not the radiation, but looking at the patient as a whole. So just really important for, yeah, even if you don't know, even if it's not a patient who come to you, either a physician or a physical therapist out there, and it's like, okay, I understand I'm not the expert on your diagnosis, but I, again, guide them through who is the expert on those diagnoses and just guide them to the right, you know, people or the right physician or the right therapist that knows about it, that can look at them as a whole picture and not just, let me just treat, you know, your leg or your arm or whatever you're here for. That's important. Okay.
Yeah. Yeah. I mean, and it, you know, that I think the beauty of being in rehabilitation is that when a patient comes in the door, I feel like we can talk about any of their issues affecting their body. So like you said, you know, just because they come in with a shoulder problem doesn't mean that at the end of the visit, the only thing we talked about is their shoulder, you know? And I think that's actually really great because a lot of times they do need to be heard. The rest of their body needs to be heard, you know?
Yeah, absolutely. How about if you want to give some tips to the actual cancer patient? So a patient comes to your door, and so what will be a couple of tips for the actual patient?
Yeah. You know, I think tips one, know that we're trying to help and we want to help and we want to learn about you and your story. And the questions that we're asking are meant to help guide us to help find solutions for you. And so be patient with us in that way. If sometimes we ask a lot of questions or things that might seem a little bit like, why are you asking me this? I think there's a ton of resources for a lot of different cancer specific rehab issues. And if it seems overwhelming when we are telling you too many things by mouth, ask us for written resources and written information. We can always write it down, so that way you can refer back to it later. And there's a lot of wonderful online resources, or even exercise videos, etc., that we can help connect you with and refer you to, so that way you don't feel like you need to memorize everything that we're telling you during a clinic visit. And I think from a rehab standpoint, we really do want to help the whole body. So if there's something that seems small, or you're embarrassed to share, or you're like, you know what, this is important to me, but it's probably not that important to them, and I shouldn't really talk about it. No, take that doubt away. Share it, because it's probably actually quite important. And there's probably something that we can do to help you. And if we don't quite know the answer, like Durley said, we can go connect you with the right resources. Don't be ashamed. We see so many different things and so many different problems, and we're here just to help. We're not here to judge. We're not here to blame. We're not here to shame. We just want to help.
That's very good. That's very helpful. How about it's a painful lesson that you learn along the way?
Gosh, yeah. I mean, I think unfortunately one of the more painful lessons I learned along the way is that when I'm managing and trying to treat a patient, I can't ignore the entire healthcare system. The system and the fences that are in place, and working with insurance on things like insurance authorizations and timing of things. And as much as I want, even if I think I have a solution, sometimes it can take weeks or months to get that solution to my patient. And sometimes that solution is denied, and I have to go through appeals. And it really breaks my heart when that happens, where having to say, no, I'm sorry, I can't give you the thing that I think can really help, And it doesn't mean that there's not a solution. Sometimes it means we have to get a little creative. Or if I can't be the one to provide the solution at my center, we find someone who can. So I think that is one of the toughest lessons I've learned, having to still, I can't be naive about care and healing. I have to work within the system and work with a lot of the barriers that are in place in our healthcare system, or challenges.
Yeah, but what can we do to change that? Because I just feel this is a pain for all of us.
Yeah.
And then how do we change that, right? It's like I feel like sometimes it's like our hands are so tied up, because there's nothing. I mean, you can call the case manager, you can have an hour discussion over the phone with somebody, but it is this health system that is just ruining us, because it's only getting worse, right? It's not getting better.
I know.
So,
I think advocacy, and working on policy making. I mean, take the Lymphedema Treatment Act, for example, right? I think that's such a great example of where, I think therapists and patients are pulling their hairs out, trying to get coverage for a compression. It seemed hopeless. And the fact that Heather Ferguson and her team has been working on that for more than a decade, and finally, because of the advocacy, the relentless advocacy, finally the Lymphedema Treatment Act was passed almost a year ago, right? And we're going to see those changes come to place January 1st of next year. So
Will you
I think I think that's an inspiring story, and I think an example of we have to speak up, you know.
That's right. You want to tell us a little bit, maybe for some of the patients out there who doesn't know about this, you want to tell us a little bit about the new Lymphedema Act?
Sure. Yeah, absolutely. So really excited about the Lymphedema Treatment Act. So this finally passed in Congress last December, 2020, 2022. And basically what's going to happen is prior to its passing, so Medicare does not cover compression equipment for lymphedema treatment. So for example, my patients who have Medicare weren't able to get their supplies like bandaging supplies, compression stockings, compression sleeves covered by insurance, and it would be a very high out-of-pocket cost. And so because of that, some of my patients couldn't get treatment for their lymphedema. And so starting January of 2024, the CMS criteria are going to change. And so they will now start covering compression. Of course, there are still some details being ironed out. I think there were actually some new details that just came out. So, we'll see exactly how we will need to navigate this come January. But I think the good news is we're making progress, and we're going to be able to get some additional coverage for our patients with lymphedema who truly need it.
Yeah, and that was super exciting when I heard the news. I was
Oh
like,
my gosh.
the week before last or something, right? Like 2
Yeah.
weeks. It was great. What does that means to advocate for yourself, and how can people do that?
What does it mean to advocate for myself, and how? I think that's a really good question, because I have not historically been a good advocator for myself. I tend to be a bit of a pushover, and and I tend to say, okay, okay, fine. I don't want to push anyone's buttons. I kind of want to keep things peaceful and harmonious. And I realized that there are situations where maybe that is a good thing, and I think there are certain situations where that's not such a good thing. And I think it is really important to be able to speak up for yourself. And so I've learned along the way to grow some thicker skin. And so when I see something that isn't right, that I make an effort to speak up. It hasn't been easy in any situation. But what I have found is when I do speak up and ask for something, a lot of times the answer back is not a no. So I realized that there are absolutely opportunities to make progress. Where in the past, I might have just sat by and watched an opportunity pass, right? Because I was too afraid to speak up.
Gotcha. And how will you translate that if you want to give an advice to the cancer patient?
Yeah, I mean, I think I have patients who come in the office, and for example, they might have seen a variety of specialists in the past, and have felt not listened to. And when they come in, they communicate strongly about their needs. And I think that can be a really good thing, because when we have a limited time in the office, and when patients, especially with a cancer history, come in with a very complex medical history, it's easy to get lost in details. Or when someone isn't quite able to share exactly what the most important things they want to get addressed are. So I think when patients are able to advocate for themselves and express what their priority issues are that they want to get addressed today, it can really help the visit, and for me to make sure that they find the visit productive. So kind of going back to that communication and listening. So on my part, I want to be a better listener. And I think when a patient comes in and is able to really express their needs, it helps. So I think that's one way of advocating for yourself. But I also think other ways are, there's been times when in a complex medical situation where we're all the clinicians are a little bit unsure what might be going on, but a patient knows their body and they may feel fairly strongly that, hey, something is wrong here. And so I've had patients who've really advocated for themselves in that way by being persistent and saying, hey, I really think this needs to be checked. Can you please, and I think that opens a door for another conversation. And there have been times where, because the patient advocated for themselves and pressed for a specific, a test or a workup or another physical exam, we finally were able to find something that previously had been missed.
Mm-hmm. Yeah, that's very good. And sometimes I tell patients that, right? Sometimes patients come to us because they're frustrated with the physician that doesn't have the time to listen, and they're rushing and out of the room, and they come with all these questions. And I try to guide them, and I try to be very respectful in regards, this is a medical question that you have to ask your medical oncologist or your PM&R physician or your surgeon. But don't be afraid to do it. Just write all those questions. And at the moment the physicians walk on that door, just tell them you're not leaving until you answer these questions, period. And then just say it like that. It's nothing. And that's when, unfortunately, what will take for that physician who is on the rush to just like, oh no, I gotta stop here for a second and listen to this. They are just not gonna ignore that. So we have to kind of give them that power of like, it's okay to say no, it's okay to do more research. It's okay to bring research on the table and say, well, what are you thinking about this other plan that this other institution is doing? Don't be afraid to do that, because like you say, to help you, and certainly you're part of it. It's not like we're just going to do things without you being agreed to it. So
right. Yeah, at the end of the day, you're making decisions about management of your own body, and so you should absolutely feel comfortable with the other person who's rowing that boat with you, and down this journey. Because if you don't feel comfortable with your partner, that's not a good sign. That's not necessarily going to lead to the best outcome.
Exactly. What are good resources for patients to use to educate themselves?
Yeah. So, I think specifically cancer rehab resources. Well, for example, at University of Pennsylvania, we have a really great website called oncolink.org, and actually anyone can access it. And so there's a lot of cancer specific information on there regarding treatment and symptom management. And there's some really great information also about things like lymphedema, and precautions and restrictions and how to exercise safely, etc. So I think that can be a really great resource. In terms of things like exercise, some institutions have their own individual resources, but I know like Memorial Sloan Kettering, and I think actually Brigham or Mass Gen, I can't remember which one, has some really great YouTube videos of aerobic exercise sessions, and even resistance training sessions and different intensities that you can do to follow along. Livestrong has some great resources as well. And then in terms of other, like if we're talking more specific lymphedema, the Learn website has a lot of great resources. And then of course the National Lymphedema Network has the position papers on specific lymphedema related issues like travel, and so forth.
Okay, that's very good information. How can people find you?
Great question. So I have University of Pennsylvania or Penn Medicine has a page for every physician. So I think if you just search on Google, my name, MD, Penn, what should pop up is my face sheet and our contact information and the locations where I see patients.
Okay, great. And I will certainly put that on the podcast notes as well.
Great.
What is one question that you wish I'll have asked you and you will have answered
it? Great question. I think probably, ultimately what inspires me every day to go to work. Um, I think being a physician is not an easy job. I think I sometimes, in a full day, I sort of visualize it almost like I'm part of um a movie, where there's all these different short stories, right? That happen in 30-minute intervals.
Mhm.
And it's bookended by my own life, right? And I think any clinician can say that, and you could probably apply it to a lot of other fields, but it's, you deal so intimately with human beings in
Mhm.
such vulnerable places, and the trust that has to occur in the room for it to be a successful visit is really incredible, if we really step back and think about it.
Yep.
And so, I sort of visualize it as, you going into the hospital and you sort of hang like your life on a coat hanger, right? And then you go into a room and you have this beautiful story with someone, right? And then you hang that story and you put it, in the electronic medical record, and then you move on to the next one. But I think that might minimize it a little bit, because you always carry a little bit. You can never hang everything in your own life or in someone or in your previous interaction a minute ago in a book or on a hanger. You
Yeah.
carry pieces of that with you,
Yep.
and there's energy from that you pass on into the next room. And so I would say that was kind of a long-winded way of just sharing how special I think our profession is as healthcare providers. And I think ultimately that's what really inspires me to go to work, is just what a unique thing that we're able to be a part of, and how privileged we are to have these moments with other human beings, to make these connections, and how important those connections can be, and how impactful not only can we be, but I feel like I've learned so much from my own patients, and
Yes.
how much they've changed my own life, right? And how they made me grow and become a better person. So, I'm grateful for that.
Yeah. And then you just really bring a good point. I've been a PT for a while, but doing orthopedics for the longest time and just oncology for like the last 15 years.
Yeah.
And it's amazing how, yeah, like you just learn to the story of these patients who have that dealing with cancer, and how all of a sudden other little situations, it's just really doesn't really matter as much anymore, right? So, the fact that my neck hurts here and there, it's like, so what? If
Right, right.
patients are dealing with all these thousands of things one after the other, that is like, I have nothing to complain. I have to be really thankful for what I have every day.
Yeah.
That really definitely made a change on my way of practice as well, and to see life a little bit different.
Yes.
And just,
Yes.
I don't know how you feel when working with cancer patients, but I think that's just the more grateful population out there. Like,
Yes. Oh
it's
my gosh.
amazing how they just can come through the door feeling terrible, just because they just came from chemo or radiation, and they walk out of here with like a completely different. Like, it's so great to see how in 45 minutes I can change how they walk out,
Yeah.
feeling so much better and with some hope than when they
Yes.
came in through. So
Yes.
it's
Yes.
it's really challenged a lot of the things that sometimes, I see just life, like, again, I shouldn't complain, you know.
Right. Right. It certainly puts things in perspective, and our patients are some of the strongest people I know, and it also reminds me that life is unpredictable, and we can plan all we want, but I think, you have to sort of walk into each day with just sort of open arms, and just be prepared for the things that you can't prepare for.
Yep, absolutely.
You
Yeah,
know?
you just never know what will happen.
Yeah.
That's amazing. I have one more last question and I'll let you go. What are your thoughts? And I know this is a little bit can be controversial in a way, but
Mhm.
for a while, we used to tell patients do no exercise during cancer versus now we are more like, no, we're looking into high interval trainings.
Mhm.
So what are your thoughts on like how hard to push patients
Yeah,
through a cancer treatment?
yeah, absolutely. I think there are always going to be the recommended guidelines and what we have written on paper. And then there's going to be the patient. So I think we always have to remind ourselves that we take guidelines and use them only as a guide, and then we modify them to fit the patient and the person. And so currently, yes, the recommendations are absolutely for exercise, and the American College of Sports Medicine has recommendations for to essentially summarize. I usually tell patients 3 days a week of aerobic exercise, moderate intensity for 30 minutes, and then 2 days a week of resistance exercise of major upper and lower body muscle groups. But that being said, start slow and with what you can tolerate and then work up. That is quite intimidating. And I would say the majority of Americans are probably not exercising at that goal. And so it is totally okay to not be there from the get-go. And it's totally okay on the days when you have chemotherapy or radiation, when you're feeling really crappy and your body is just telling you, hey, I need to rest, for you to rest.
Mhm.
Mobility is good. And so as you're able to tolerate, do get up and move around a little bit, even if it's some ankle pumps and arm raises, just get the body moving a little bit. And on the days where you can, start working up to that goal. And I think there are also ways to get creative. So for some people, they're like, well, I really don't want to do aerobic exercise. I hate it because I hate running, I hate jogging, I hate walking. So maybe let's talk about what about stationary biking, or what about using something like an upper body ergometer, or what about getting in the pool, and even if you can't swim, just walking in the pool.
Yep.
We can even do little arm weights on the pool to make it even more productive. So I think there's a lot of other things that we can brainstorm to make it more palatable for someone if there's certain things that they don't like to do. But I do think, yes, so at the end of the day, exercise is important. I do follow the American College of Sports Medicine guidelines, but I always have folks start, where they're at and slowly increase it from there in terms of intensity and time. And also knowing that it is okay, absolutely, for days when they're really busy, have appointments, have treatment, that they may need to rest, and that's actually not a bad thing. And finally, I will say there's been so much, fabulous evidence coming out about the benefits of exercise in treating cancer, and the fact that the moderate intensity of exercise, moderate to vigorous intensity of exercise, actually stimulates certain kinds of immune cells in our bodies to circulate better through our bodies and find the tumor cells. Yep. And to kill them. Yep. And so I absolutely encourage it. I think it's, we should treat exercise just like we treat prescribing a high blood pressure medication for someone who has high blood pressure.
I love that. Yep, yeah. I love that. I think that, again, this is as well a culture of, let's give me the pill that do the magic, but I don't need the effort. So I think that as well, it's nice to see a little bit of a shifting on culture in regarding how more people is more conscious about the importance of exercise, the importance of the nutrition, the importance of weight management. So definitely, I think is that I'm seeing a little bit more of a shift on that. Yeah. For the good. So it's not as a foreign word as used to be many years ago. And locally we're changing that a little bit more into, it's not the magic pill, it's really you gotta do the effort yourself.
Yes.
organize and get a part of your routine. And when you do it and you feel great, then you'll do it, and it's not going to be a struggle anymore. So
Yeah. And it will be hard, right? It will be hard. It's not going to be magic where, you're going to do 30 minutes and feel great, right? So initially it will feel hard, but it's going to get easier. And I think it's that consistency that's also so important. And I think us as human beings and human nature is, consistency is really hard, and making habits happen. I mean, there's a whole science behind it, right? Is really hard to do, but that's, whatever you can get in, even if it's 5 minutes, just do it. Yeah.
Absolutely. Well, Dr. Zheng, thank you so much for doing this with me today. I have so much fun talking to you. I really appreciate your time spending with us and then give us all this valuable information.
Absolutely. It was my pleasure. It was so nice talking with you, Durley. And thank you so much for having me on this. It's been such a special treat.
Okay, great. Thank you. Have a good evening.
You too.
Bye.
Goodbye.